Well, back pain is the second most common neurological ailment in the U.S. Only headaches are more common, and that's why Americans spend $86 billion a year treating an epidemic of back pain. That includes the 800,000 people annually who have back surgery, according to the American Academy of Orthopedic Surgeons. For many patients, surgery doesn't get rid of the pain, and some are turning to a non-surgical option called spinal decompression. Orthopedic surgeon Dr. Jacob Bukowski says being overweight, sitting too much, and having weak core muscles contribute to an epidemic of back pain, especially herniated discs.
So what can happen when you have a disc herniation is that the disc material, which is again in the front of the spine, can herniate and protrude through and put pressure on those exiting nerves. And as a result of that, you end up having a lot of pain.
I just couldn't move, literally could not move. And I got an MRI and found out that I had 3 discs that were bulging.
So your back's feeling good now?
Feeling great. Yeah.
71-year-old Buck Krieger tried to lift a tractor to change a tire. His back paid a severe price, and he elected to treat the pain with spinal decompression.
It took me probably 8 or 10 or 12 visits to really get down to no pain. But I mean, I had pain coming around the front of my leg, down to my knee. I mean, it was everywhere. It was really bad.
It gives another opportunity to be very conservative, to treat a condition that's very difficult, a lot of pain for the patient when they have a disc bulge.
Spinal decompression therapy is a non-surgical treatment for various types of back pain, including herniated discs, sciatica, and degenerative disc disease. A computerized traction device like this one slowly and gently stretches the spine, taking pressure off compressed discs and vertebrae.
Not a static pull, but it actually goes through a rise of pulling and then a decrease in pulling. That wave completely allows the muscles to relax. As it does that, it creates a vacuum. That vacuum creates a negative pressure. There is actually relief for many of the patients as they lay on the machine in a relaxed state. And as they're relaxed, the bulge actually begins to pull back up and pull apart very gently. And most patients have no pain. They should have no pain, actually, as they're on the machine, indicating that we're helping to relieve the nerve irritation as it's there.
Critics say there is limited scientific evidence to support the effectiveness of non-surgical spinal decompression therapy. Yet the procedure is gaining acceptance as patients seek pain relief.
I have had patients who have told me that they have gotten relief through those kinds of treatments. So I think it is a reasonable thing to try in the appropriate circumstances.
I'm feeling great again, and I, knock on wood, I haven't been back for a year and a half, you know, and the only time I did come back it was my own fault because I lifted the darn tractor.
Each session lasts about 30 minutes. It can take 20 to 30 treatments to eliminate back pain. Although the Food and Drug Administration has approved spinal decompression, some insurance plans consider it experimental and won't cover the treatment. Now, anytime you have a spinal injury, it's imperative that you do your homework. If you decide to try spinal decompression, find an experienced doctor. I have a special interest in this topic, and in the interest of transparency, I had disc surgery after more than a decade of chronic back pain, and surgery didn't work for me. 6 weeks of spinal decompression ended my chronic back pain, and I can actually play golf, which I never thought would happen, and so it's an option.
Did it make you taller after all that stretching?
Not that I'm aware of, no.
Well, you know, when people have scoliosis and get surgery, they get taller.
Well, I don't know.
Have you checked?
No, I haven't, but I feel a lot better.
That's good.